So together as a society, we need to get everybody promoting healthy environments, improving the conditions of daily life, and strengthening our health systems. So we have a lot of emphasis in the past of particular subject areas within education, and I think we need to think about the Lifecourse as being within the centre of this web, if you like, or this network of educational activity. And we need to embrace all of the disciplines that from public health and epidemiology, sociology, psychology, medical and dental sciences, community dentistry, and basic dental sciences, and more throughout the Lifecourse. I think it's important that we embrace everything, and it all sort of feeds from each other. In terms of a curriculum framework, this document, which I'd lead you to, and this presentation will be up on the resource session. The key thing is to have an interdisciplinary framework, so that there's a link between the current islands of teaching, especially in relation to social and psychological topics, and that this requires a multidisciplinary approach from staff to coordinate teaching. So really, the educators are the ones we need to educate to make a change in how we are teaching and framing our education. And promoting an inquiry-based learning approach, so that our teams, the educators, especially the deans, the leaders of our institutions, can help frame a curriculum so that the undergraduates, postgraduates, dental teams, and also continuing professional education and development all encompass this life approach. Because I think everybody will be, if they're a pediatric dentist, they will go and do pediatric CPD, and sometimes they may not look at the picture in an older person, for example. So we need to be less sort of silo orientated. But there are challenges to adopt this Lifecourse approach, and I think the key things I've highlighted in bold, which would be the division of preclinical, clinical courses, and the fact that most schools have already adopted a curriculum with a modular structure, and that means that integration is quite difficult. Everybody will say their curriculum is over full, time limited, and it depends on the philosophy of the school as to whether they're going to do this. There have been examples of how the Lifecourse can work, and I'd lead you to this example from two small countries in Europe, which are Malta and Iceland, how they have used a Lifecourse to make changes within their countries. However, they say there are recognised challenges in doing so. So you can have a little look at that. And again, the key things are trying to get the deans on board and trying to get other educators on board as well. In Liverpool, we're fortunate to be able to have a new centennial curriculum to next year, so we're going to be providing combined teaching for dental surgery and dental therapy students for the first 3 years of their degree. And we're hoping that perhaps we can embed special care dentistry early and also adopt a Lifecourse approach, so that anyone who is working in a school where you're able to make changes in a curriculum, and I know a few of you are taking up roles within different universities where you can start to make a change if you start at the advocacy approach early in order to add the sort of work that we would like to take part in terms of special care dentistry. The future role for the IADH education will be to continue to support knowledge exchange with IADH members. We want to upgrade and update the undergrad and postgrad curricula, because they're supposed to have a 5-year period of time, and that's now. So we need to sort of think about anything to add to that, and we will canvass any information or comments from everybody. But also to say we've been lucky to, Alison Dougal has worked with the IFDEA, the International Federation of Dental Educators, and there's going to be an annual award of €500 for presentations in education and special care dentistry. We're hopeful that that will happen at each congress. So we're going to register on their page, and also that will mean we can share content, hopefully with the IADH education resources, and there'll be a discussion forum as well. continue our advocacy through the deans and the institute leads to embed education, and also with Sharat's wise knowledge to have webinars, resources, podcasts, and we can put those under a common Creative Commons license so they can be attributed to the school that is providing the resource for people to use. We probably take off any patient identifiable resources or anything that's not got permissions to share. And the last slide is I'm going to be updating the terms of reference of the IADH education. We're going to put a call out for membership for the committee, and that will be carried out through the new committee structure, which will be announced later. We're going to organise another session in Mexico, add more resources, and foster relationships. So anytime you have an opportunity to express what special care dentistry education can do for your countries, is to go along there and be the one flying the flag of special